Good evening, everyone, and thank you, Dr. Shweta ma'am, for the introduction and also giving an overview of this particular CQE series program. And it is my honor to introduce the speakers as the host of today's session. And without much ado and delay, I would like to introduce the first speaker for the day. That would be Dr. Indu Bala. She's the Assistant Director at NABH and currently responsible for the AYUSH Accreditation program of NABH and has over 11 years of experience working with various prestigious hospital brands in as a project team head, meeting the requirement for commissioning of new hospitals, implementation of various NABH and JCI accreditation standards, and achieving the accreditation, developing, implementing, and streamlining the processes in the operations in various clinical areas. She's also worked on the Wipro HIS and Atharvan HIS for various hospital HIS modules during the project and implementation phase. She was last working as prior to NABH as senior manager and head quality department at BL Kapoor Super Speciality Hospital at New Delhi. And incidentally, Dr. B.L. Kapoor was awarded the best hospital in India in the quality systems by AHPI during her tenure as a quality head. And she has been honored as Women of Substance by the B.L. Kapoor Hospital in 2018. So it's such a very prominent and eminent accolades to her name. I welcome Dr. Indu Bala for her presentation. Over to you, Dr.
Good afternoon, everyone. I'm Dr. Indu, and I work as an assistant director at NABH and look after AYUSH accreditation program of NABH along with the various other programs like small healthcare, lab, blood bank, and new software for the NABH. Before I begin, I would like to take a moment to thank the leadership of CAHO and the organizing chair, Dr. Shweta, and the committee members for conducting this webinar on continuing quality education series 24 for quality and standardization in AYUSH sector. Thank you, everyone. Thank you for having me here and giving me this privilege to talk about AYUSH accreditation program of NABH. I would like to also thank CEO NABH, Dr. Atul Mohan Kochar, and Director NABH, Dr. Poonam Bajaj, who are the brain behind all the successfully running programs of NABH, and who gives us ample opportunities to connect with people at various forums and share our views on quality and accreditation. So, coming to the presentation part, I'll be talking in brief about NABH, and then we will come to the AYUSH accreditation and certification program of NABH. So NABH, as you all know, NABH stands for National Accreditation Board for Hospitals and Healthcare Providers. It's a constituent board of Quality Council of India, QCI, and it was set up in 2005 in association with Government of India and Indian industry. And in 2006, we launched our first standards for accreditation of the hospital. And now we are, running fifth edition of the hospital accreditation standard, which is our parent standard. In 2010, we expanded internationally and we have our presence in Oman, Afghanistan, Bangladesh, Bhutan, and Maldives. Our mandate is to propagate the healthcare quality standards in all important spheres of healthcare delivery system, help in adoption of these standards by healthcare organizations, and then ensuring the continuous adherence of these standards through our pre-defined assessment and reassessment and surveillance processes. Vision of NABH is to be APEC's national healthcare accreditation and quality improvement body, functioning at par with global benchmark. Our mission is to operate accreditation and allied programs in collaboration with stakeholders, focusing on patient safety and quality of healthcare based upon the national and international standards through the process of self as well as the external evaluation. Our core values are credibility, that we tend to provide credible and value addition services. Responsiveness, we are willing to listen and continuously improve our services. Transparency, we believe in openness and communication and freedom of information to all our stakeholders. And we incorporate change, creativity, continuous learning, and new ideas to improve the services being provided. NABH is an institutional member as well as a member of Accreditation Council of ISQA. We are institutional member of ESQA as well, that is Asian Society for Quality in Healthcare. NABH as an organization is also accredited by ISQA, and our current accreditation cycle is valid till June 2026. Our parent standard, which is the main standard of NABH, that is the hospital accreditation standards, that is also accredited by ISQA, and it is valid till April 2024. And we are now in the process of renewal of our accreditation for the hospital accreditation standards. We our core activities, we mainly we accredit the healthcare facility, we certify, we promote the quality through various certification programs such as nursing excellence. We have lab, blood bank, and many other certification program running. We endorse various healthcare quality courses and workshop as well. We continuously focus on the education part through various public lectures, webinars, seminars, and advertisement. So as of now, we have 25 accreditation and certification standard in public domain. All our standards are available on the NABH website for free download, and guidebooks can be purchased. Our core activities, as I mentioned, we are running mainly accreditation program. We have accreditation program for hospitals, small healthcare, which is up to 50 bedded, various AYUSH hospitals of all the disciplines, radiology, eye care organizations, blood bank, panchkarma, clinical trials. We have certification program for AYUSH, a separate entry-level certification program for hospital as well as the small AYUSH centers. We have a certification program for the laboratory, emergency department, nursing excellence. We have various empanelment programs running for CGHS, ECHS, and various projects with the government as well as the private organizations. As of now, the data till 31st of December 2024, we have 15,600 plus organizations which are accredited and certified with NABH, and we have 4,100 plus organizations impaneled with us, and we are looking forward to scale it up to 1 lakh plus healthcare organization on the panel of NABH as accreditation or a certified organization. So this is the data as on 31st December 2023 for the various programs of NABH, accreditation, certification, as well as empanelment. So now coming to the AYUSH program of NABH. So we all know that AYUSH is the acronym of the medical systems that are being practiced in India, such as Ayurveda, Yoga, Naturopathy, Unani, Siddha, and Homeopathy. And another Indian system of medicine, which is, you would be aware of it, which is known as Sowaripa, also called as Amchi medicine, is also, which is practiced in some part of India, has now also been recognized by Ministry of AYUSH, and it has come up as an amendment to the Indian Medicine Central Council Act 1917 in September 2010. These systems are based on definite medical philosophies, and they represent a way of healthy living with some pre-established concepts on prevention of disease and promotion of good health. These programs are there to rejuvenate the body through diet and nutrition. They offer treatment methods to cure many common diseases which have few modern treatments available. The basic approach of all these systems on health and disease and treatment are holistic, as we all know. Therefore, it is very, very important that such services are offered in a scientific and reliable manner by trained and competent professional, and in a safe environment, in a safe infrastructure. The accreditation of these facilities on the basis of predefined criteria, which we have defined in our various accreditation standard for AYUSH, can ensure not only this evidence-based practices being followed, but also it can provide a way forward to continuously improve the quality of services and the patient, where the patient safety becomes of utmost importance. So mainly our accreditation program, we have a separate accreditation program for the Ayush hospitals. Ayush means for all the disciplines of Ayush. That is, we have a separate program for Ayurveda hospital, for yoga and naturopathy hospital. We have a separate program running for the Unani hospitals, Siddha hospitals, and homeopathy. We have a separate accreditation program for the Panchkarma clinics or the daycare Panchkarma centers. And these accreditation program we started in 2009 along with the Ministry of Ayush, and as of date we have 300 plus Ayush hospitals and Panchkarma centers which are accredited with the NABH, and many are in the process of getting accreditation. In 2019 we started a separate program of Ayush entry level certification for the ease of the quality standards, and this program was launched. And this is also we have a separate program for the Ayush hospitals and a separate entry level program for the Ayush centers. So again, as I mentioned, all these standards are available on the NABH website for the free download. Many of the we get a lot of call every day how to get these standards. These standards are available on NABH website under a tab called documentation, so they can be downloaded. Uh, Guidebooks can be purchased. You can write an email to us. We will facilitate you. Now coming to the detail, we have a hallmark approach of having 10 chapters in all the standards of in most of the standards of NABH, and all the chapters are further divided into the standards, and standards have been further divided into the objective elements. And in our guidebooks we have given a complete interpretation of the objective elements, how a organization can implement that particular objective element and sustain that further. So in Ayurveda we talk about 10 chapters, 98 standards, and 590 objective elements. And in yoga and naturopathy we talk about 51 standards and 505 objective element. In Unani we talk about 96 standards and 491 objective elements. In Siddha, we talk about 92 standards, 475 objective elements. Homeopathy, we have 104 standards and 675 objective elements. And in Panchkarma, we have 52 standards and 225 objective elements. Currently, we are working on integration of these various standards, and we are already done with the revision and the integration of the standards for the clinic for all the disciplines of Ayush. As of today we have the accreditation standard only for Panchkarma and daycare Panchkarma centers and clinics. In near future we are going to come up with the accreditation standard which are almost done, and we are going to soon post them in the public domain for the comments, and we'll be sharing it with all of you as well. So these new standards will be covering all the clinics of Ayush, that is homeopathy, Siddha, Unani, yoga, naturopathy, and Panchkarma also be a part of these new integrated clinic standards only. And this will be covering the daycare aspect also. And once these standards are released, we will be further integrating the hospital accreditation standard. That is, we will be having one standard for Ayurveda, yoga, Unani, naturopathy, and homeopathy, one standard for IPD for the which will be covering the IPD part, and another one which will be covering the clinic as well as the daycare part. So that is the way forward. Now, who can apply for the accreditation program? Our requirement is minimum 10 bedded setup for Ayurveda, Unani, Siddha, homeopathy, and for Panchkarma clinic, the clinic or the center is supposed to have at least one Panchkarma table. And yoga and naturopathy, the daycare centers can apply under the yoga and naturopathy also. Are all the chapters in all the standards of any various standards of NABH, be it for the hospital, small healthcare, or Ayush, or the blood bank, we have divided our chapters into the two parts. One is addressing the patient centered standard, another is addressing the organization centered standards. I will not get into the details of the chapter, as my fellow colleagues and speakers, they'll be taking up the session on the details of the chapters. So key aspects, the our chapters mainly focus on the patient care, how to provide a safe patient care, and how to provide evidence based patient care, focusing on the continuous quality improvement as well as the safety of the patient. Our focus is on infrastructure and facilities. In our chapters like FMS and HRM, we are talking about how an organization should provide a safe infrastructure in terms of how to deal with various emergencies. And then emphasis is on having a competent staff who is taking care of the patient, the doctors and nurses. We talk about the management of the medication, storage part, prescription, and the monitoring of the patient after having the medication. We ensure that patient rights and responsibilities are protected in the accredited organization, and a continuous quality improvement it has been focused through the by having various quality indicators and implementing the various quality improvement programs in the various clinical areas of the hospital. And then we focus a lot on ensuring that ethical practices are adhered in the organization, and management has to ensure that. And we're talking about this in responsibility of management chapter. Our objective is to provide a framework for the quality assurance and quality improvement. Our focus, as I mentioned, is on patient safety and quality of patient care. Our standards are periodically revised, and every time we raise a bar, and we set the basic standards. So now, in our upcoming accreditation process, which we have already revised for the other programs of NABH like hospital and small healthcare, wherein we have kept a graded approach. That is, certain standards and certain objective elements which are very basic requirement for the quality and patient safety, they are to be adhered minimum during the first assessment, that is the first final assessment of the hospital. And then gradually we raise the bar, we add up some more objective elements or some more criteria during the next assessment, that is the surveillance assessment, and then further some more criterias during the reassessment of the hospital. And we have divided the our standards and the objective element into core, commitment, achievement, and excellence, that is the four levels. And the same methodology we've been doing for the Ayush hospitals and Ayush centers as well. And our target is also to get the international recognition for the Ayush accreditation program of NABH. This is the mark of excellence which is given to the organization once they achieve the accreditation. There is a separate logo of NABH for the certification. So our program, Ayush program, is there to ensure a quality based approach that is not only effective but efficient for the Ayush system. It's our unique initiative that accreditates and enhances patient safety and healthcare quality and promotes evidence based care in over 4,000-year-old Indian traditional medical domain. Now, coming to the Ayush entry level certification program, our standards for the certification program are very generic, simple, and very easy to understand. We have two certification programs, one separate for the hospitals and another program which is for the daycare centers of the Ayush. All the Ayush accreditation standards as well as the certification program is endorsed by Ministry of Ayush. Entry level certification program is cost effective, and it is there is a complete separate online portal for the certification program. So this is covering hospitals as well as the daycare centers. The standards are available on the website for free download. And in Ayush certification program, we have 37 standards and 146 objective elements. And in the Ayush certification program for the centers, daycare centers, we have 29 standards and 140 objective elements and 8 chapters. This is the user ID and login page for the entry level certification program. Uh, uh, In 2022 September, we have signed an MOU with the Ministry of Ayush for the NABH Ayush entry level certification program under National Ayush Mission, wherein we've been targeting to certify 12,500 Ayush center under the entry level. We've already done 400 plus, and which have been certified. The assessments have been closed, and for 1,100 we have already conducted the assessment. The further certification is in process. Our standards of NABH Ayush standards are endorsed by Ministry of Ayush. So as of 31st December, we have 300 plus Ayush hospitals and Panchkarma centers which have been accredited. And in the entry level program, we have 23 hospitals which are certified and 55 centers which have been certified. And under this NAM project, we have 400 centers which have completed the certification process. NABH follows a evidence-based process which has a focused approach towards the quality assurance in healthcare and patient safety. NABH Ayush accreditation gives the healthcare organization a strong foothold in the Ayush-based medical care and further consolidate its position as authentic Ayush healthcare providers. Our motto is taking the best quality healthcare service to the last man in the line. We are also available on LinkedIn. We have our YouTube channel, and these are the these given for this. With this, I would wind up my presentation. Thank you, everyone. Thank you for the patient listening, and now I'm open for the queries. Thank you.
Thank you, Dr. Indu, so much for the insight that you've provided in the entire how to go about with the accreditation journey for Ayush hospitals.